Good morning. You're welcome to the antenatal class. Please, for those still joining the class now, please, as you enter the class, please mute yourself. Good morning. Please, as you enter the class, please mute yourself. You're welcome. Like I said earlier, if you have any questions for the class, you can drop it in the chat box, or you can save your questions for the Q&A section at the end of the class. We're starting off the class. You're welcome. My name is Nurse Ugwu. And this morning, we'll be discussing personal hygiene in pregnancy, diet in pregnancy, mode of dressing in pregnancy, and exercise in pregnancy. So I enjoin every one of us to please listen very carefully. If you have your questions, save it for the Q&A questions, or you drop it in the chat box. Thank you. Personal hygiene in pregnancy. This will be looking at hair care, skin care, breast care, bowel and bladder care, and vaginal care. As we all will know, pregnancy is not a disease. It's not a sickness. So the fact that you're pregnant does not mean that you should let yourself loose and forget every other thing about yourself. You can still be yourself fully, take care of yourself, appear smart and neat, and you don't need to feel that you're carrying a burden. So we're looking at hair care. Why do you need to pay special attention to your hair while you're pregnant? The hair tends to be more oily and grow more when we're pregnant due to the overactivity of the glands in the scalp. So the hormones affect also the growth of the hair. And when we talk about the growth of the hair, not just our hair, the hair on the head, we also have hairs in our armpits, and we also have hairs in the vagina. So all those things, they tend to grow more. So we need to be more conscious of the fact that you have to be shampooing the hair and then bathing more often, washing the hair more often. It's no longer a situation where you have to wear one hair for like 3 months without water touching it and all. It's going to be releasing a certain kind of smell that you yourself will not be comfortable with. And also you have to know that you have to be more frequent with cutting of the pubic hair and the hair in the armpit, and the hair in the armpit and the hair in the vagina side. You have to be more frequent in cutting them because they tend to grow more. Then we're looking at skin care. The glands in the skin they also become more active, causing increase in perspiration. That you tend to sweat more when you're pregnant. So because of the, please, as you join the class, please mute yourself. Please mute yourself. Thank you. Thank you. The glands in the skin become more active, causing increase in perspiration. There's increase in sweating when you're pregnant. So we need to be conscious that frequent baths are more recommended. So you can bathe 2 times, 3 times, as often as possible. It doesn't necessarily have to be once in a day. So as often as possible, you need to have your bath because of the increase in sweat. The more you sweat, the more the skin reabsorbs these things, and the more it can lead to different kinds of body odor. And then while we're also talking about bathing, we have to be conscious when we're using baths and using tub baths and all, because tub baths tend to increase our risk of infection. So we need to be conscious of that. If it is possible, we can avoid it. Then The reason why you also need to bathe more often is not just because it helps you to look clean, it also helps to relax the muscles. Most of the muscles tend to be tend to be very tensed in pregnancy. And also, when you bathe, you feel refreshed, and it can counter certain kinds of insomnia. You can sleep better, and it makes you feel fresher and more, makes you feel good with yourself. And if you're using shower and all, you have to go into the bath, please remember that it is possible, it is necessary for you to put a rubber mat in the tub or in the shower to avoid you sleeping. You need to be very conscious about falling when you're pregnant because it predisposes you and the baby to a lot of risk. And you have to try and use more of organic products for your skin. Remember we said the glands in the skin are more active, they are more open too. So when you use too much chemicals, and one of the ways the body absorbs things is through the skin. So anything you're using on the skin will be absorbed much more faster too. So if possible, go for organic products. And as little as it may, or as frequent as you may bathe, you might not need to all the time. If you cannot get hold of, you cannot use organic products, you can as well just bathe without using the chemicals. Just have a normal shower and just feel fresh with yourself. Then we're looking at breast care. And we need to pay more attention to our breast during pregnancy, because what you do with the breast and how you prepare the breast will also determine how effective your breastfeeding will be and how fast the breast milk can also come when the baby comes. So we need to pay more attention to the breast because there is increase in size and there is also increase in tenderness of the breast while you're pregnant. And also you will notice that when you're pregnant that there's a discoloration of the areola of the breast. There's a discoloration. Some become darkened because of hormonal changes too. So, and also we can notice that sometimes the nipples also become more prominent in pregnancy. So to help with all these changes and to help you to adjust with all those changes in the breast, you have to wear a bra that provides a firm support. Buy a bra that fits without pressing or binding. As you're progressing in pregnancy, you can be changing the sizes of the bra because the breast will tend to be getting bigger and tender. So if your bra is not comfortable enough, it can make you feel a certain kind of pain, and then it will make you very uncomfortable. And also you have to know that when you wear bra and the firm bra for your breast that provides support, it tends to reduce the pain that you feel because the breast is tender due to the hormonal changes. And if you have a very big breast, it might be more comfortable for you, even though it is not all that advisable to wear a bra at night. Then focusing on the nipples, there tend to be discharge of the milk, the first breast milk, which we call colostrum, from the milk while you are pregnant. It is yellowish in color. It's not a sign of abnormality. It is because of the pregnancy hormones. It's because of the hormones that actually causes this milk to come out. And it's also a sign that the body is preparing for breastfeeding. So because of this milk discharge from the breast, it is necessary for you to clean the colostrum from your breast using only warm water. Please avoid using soap and alcohol-based cleansers. They can dry the skin and they can cause soreness of the nipple and also cause the nipples to crack. And when nipples crack, you find it very difficult to initiate breastfeeding when the baby comes. Now, if the colostrum leakage, if it is a problem, if it is getting more like you have more discharges coming from the breast, you can wear an absorbent pad. You can put it in your bra and replace it when it is wet to avoid irritation. The fact that we say you should put on a pad doesn't mean that you have to wear one pad from morning till night without changing it. Please, there is need for you to change it because it also has this kind of pungent smell that is very, very uncomfortable and unpleasant. So if you're using a breast pad, please change it as often as possible. And also, for you to be preparing the nipples for breastfeeding when the baby comes, that is, if you want to breastfeed, you need to massage your nipples with coconut oil to aid blood circulation and also to prevent dryness and cracking of the nipple. This is very important. The more often you do it, the more prominent your nipples can become, because some of us, when we give birth to our babies, we notice that our nipples are depressed. It's either they are depressed or they are inverted, they are inside, and the baby will find it more difficult to latch. So you need to pay extra attention to the nipples. Now, coming to the vagina, we already talked about the fact that the hairs in the vagina also grows faster when you're pregnant because of the changes in the hormones. Please, it is the vaginal secretions also increases during pregnancy due to increased circulations and hormonal changes too. So you might be seeing more discharges from your vagina. There are discharges that are normal, there are ones that are not normal. Like when you see certain discharges from your vagina and they tend to be increasing in quantity, there are ones that when you like when there's a foul smell of your discharge, and then the color of your discharge too will tell you when if it is a point where you should see a doctor or call the attention of the nurse to the kind of discharges, because the body is also prone to more infections while you're pregnant. So we need to pay attention to the discharges that come out. And then we also need to be extra careful in the hygiene part so that we don't start having body odors and all. There might be also increased urination in pregnancy. You might have what we call urinary, because the womb presses on the bladder due to the position, and as it's increasing, it tends to any urine that enters will want to come out. So there's increased urination in pregnancy. So as often as you will use the toilet to urinate, also remember that that is as often as you have to take care of that area in the aspect of cleaning the vagina area. The vagina should be washed with water, no soap. Please, no soap. We are stressing it. I said it before, that no soap for the cleaning of the nipples and also no soap for the washing of the vagina. Please use water. Avoid vaginal douching unless it is recommended by your doctor. This is very important. Please, as much as possible, do not doubt. Whatever it is, whatever product you want to use, or whatever it is that was recommended by a friend or recommended by a sister, recommended, please do not doubt. It increases, you have higher risk of infection when you use a vaginal douching. Please avoid the use of deodorants due to high risk of infection. Like I said before, the glands of the skin, the pores of the glands of the skin are more open, they can absorb more. So the more we use deodorant. Besides, I was always told, even while growing up, that no matter the amount of deodorant you tend to put in the vagina area, it does not stop it from smelling. It doesn't, because it's supposed to have this kind of unique kind of smell. So even if you put perfume there, even if you put this there, put that there, it doesn't actually prevent it from having its kind of smell. It has a peculiar kind of smell, but we have to be sensitive to the smell and know when it becomes foul. Please wipe from front backwards after defecation to avoid cross infection. Most of us as ladies and as women, we've already been taught and we're aware that when you're cleaning, after using the toilet, after defecating, that you should clean from front backwards so that you don't introduce the bacteria that are supposed to be in the anus into the vagina, which can be very, very risky. And that brings us to the end of personal hygiene and pregnancy. There are so many things to talk about personal hygiene and pregnancy, but we just highlighted very few and vital points, which if you have comments on personal hygiene in pregnancy, you can still leave it on the chat box. And also, if you have questions, please save it for the Q&A section. Now we're moving over to the mode of dressing in pregnancy. Now, the key aim of dressing in pregnancy is that you have to wear something that you are comfortable with or comfortable in. Wear something that makes you feel comfortable and something that also enhances your sense of well-being, your sense of what. There's a way you dress. People say people address you the way you dress. Sometimes you see pregnant women because of the way they are dressed. People just think that maybe you're carrying one load or you're sick or something, or like they just don't see pregnancy as a burden. So many of us, we look for these babies. So they've come. You have to wear yourself, carry yourself with dignity. Also carry yourself, be happy. You're pregnant. You're not sick. So you have to choose loose-fitting clothing for comfort. Like I said, you have to be comfortable in whatever it is you have chosen to wear. And in as much as we're looking at comfortability, remember, you're not supposed to be thinking only for yourself now. You have to be comfortable. The baby also has to be comfortable. So you're not only making choices for yourself, you're making choices for the baby. So that's because I already mentioned that when you're pregnant, we tend to sweat more. There's increase in perspiration. Please wear lighter weight fabrics if you feel warmer in pregnancy. Because of hormonal changes, sometimes you can also feel warmer. You can wear lighter weight fabrics that can just allow you to just, and also you can use cotton clothes because of the increase in perspiration. That's the increase in sweating. Please avoid tight belts. Avoid tight belts. I know that most of us, we are still sweet 16 and on, but we need to make some adjustments. There are certain clothes that you were wearing like before you got pregnant or in your first trimester that will not go well in second trimester. And there are most of them wouldn't go well in third trimester. So as the size of the pregnancy, as your pregnancy is advancing, the size of your tummy is getting bigger, please wear things that are more comfortable. Avoid tight belts, tight bras, because these things will impede circulation. They are going to reduce the circulation. And the more when the blood that is going to the baby is the more the blood that is circulating is reduced, that means the baby is also going to receive less blood, and that can be very, very detrimental to the health of the baby. And also, please, you're already pregnant, you're not looking for a flat tummy anymore. Your tummy is not supposed to be flat. So please avoid using girdles. You can actually go back to your sweet 16 once the baby comes. We have a goal. We have a goal of 9 months, all things being equal. So it's not, you can keep all this, your pre-pregnancy clothes, keep them. You can go back to them after pregnancy. So please avoid wearing belts, bras, tight belts, tight bras, tight girdles, slacks, gaiters, knee socks, any clothes that can just decrease the circulation of blood that leads to because like there are certain things that pregnancy predisposes the body to. Some you see things like varicose veins. That's you see their veins popping out in their legs, and these veins that are popping out, they are on the legs too. They are very fragile, and they can be ruptured at any time, and that will also increase the rate of infection for you, and it is not always very pleasant. So please, anything that is going to reduce blood circulation, please try and avoid it. Find a bra that fits and provides good support for your breast. As your breast is as the pregnancy is advancing, your breast size is increasing. So please, you can change the size of your bras as often as possible for you to be comfortable. And also the bra should be firm. It should fit. It should be firm. Wear shoes that have a medium or low heel and also provides a firm support and generally good fit. Like I said before, you are still sweet 16, but you need to make some adjustments. There are certain shoes and heels that you use before you become pregnant, and those shoes, they look good on you. We're not saying they don't look good on you. They do look good on you. But you need to wear things that will, it also reduce the risk of you tripping and falling. which can predispose you and the baby to risk. And also, the more strain that you just place on those on your leg, the better. The more heel, like if you wear high heel shoes, it predisposes the leg to a lot of strain, and it still makes you uncomfortable. Because I was in a bus one day last week. I was sitting very close to a pregnant woman, and I noticed that the way she was sweating, it was not going together with the weather, and then she was just sweating extraordinary, like the sweat was out of the picture. So I looked at her again, and then I looked at what she was wearing. So I had to just tell her. I helped her to loosen the belt above the stomach, and the way she just released her breath, like sometimes it's even uncomfortable for you. So please use shoes that are comfortable. If you have to go to that party, you have to go to that dinner party, you can still look very sexy. You can still look very fine, beautiful in your low heel, medium heel shoes. Please don't wear high heels. It may result in a lot of accidents, and that's also what causes a lot of back pain and waist pain for some of us. Okay, that also brings us to the end of the mode of dressing in pregnancy. Like I said, there are lots of things, but we'll just try due to time constraints to pick some vital points. So we're going over to diet in pregnancy. Particularly for me, this is very important. This is key. So we have to be very, very attentive to this particular topic, diet in pregnancy. Before there's a say that goes that says that you are what you eat. Now you are what you eat. Your baby is also what you eat, like literally. So looking at diet in pregnancy, we're going to be looking at certain foods, and I'm going to be picking out some vital foods that we should pay attention to these days due to the situation of things, the economy and everything, and because of our country. We tend to just eat because we are hungry. But you need to pay attention to what you eat. It's not just about eating, it's about what you eat. So, by looking at why do we need to actually be diet in pregnancy? Why is it important for us to pay attention to what we eat in pregnancy? Um, we'll be looking at these foods, main foods. We talk about carbohydrates. We're not ruling out any kind of food because these are what constitutes to balanced diet. But all those things have a certain amount that should be in a particular diet or a certain amount that you should be getting in a day. Then we have some vital elements that we'll be highlighting just to draw your attention to them. And then they have increased demand of those elements or those minerals in pregnancy. We have growth foods, which are proteins. Proteins helps to repair worn out tissues, and it also helps in building blocks of some chemicals in the body. So good foods like sugars and fat are also necessary. And then we have low foods like vitamins and minerals. They are also necessary. And when we talk about main foods, like we still talk about rice, maize, wheat, millet, and the rest of them. And we talk about growth foods like in proteins, we talk about legumes, eggs, cheese, nuts and cheese, meat and poultry. We talk about fishes. So all these things, they contribute to a balanced diet. Then I was talking about that the fact that in pregnancy we we have adopted the means of giving us prenatal vitamins, prenatal supplements and vitamins, just because we cannot guarantee the fact that we can get some vital minerals in the diet. So we try to supplement, but that does not rule out that you should actually like focus on the food more than the supplement, because for every supplement, like it's still a supplement, it's still a drug kind of, for every supplement that you get, like 75 of the supplements of whatever it is in the supplement, when you urinate, you pass it out, or from the liver detoxifies it and you pass it out. So you are getting like 15% of that in the supplement. But in the food, you can be sure to get like given the method of preservation and everything, you can be sure to get the adequate amount of those elements in the foods. So we're looking at some vital elements. So for this vital elements, I'm not ruling out a lot of food sources, but I'm only going to choose some vital elements, and then we'll highlight on the sources where you can get them, because there are increased demand of these elements in pregnancy. There's a chemical called choline. Choline helps the baby's brain and the spinal cord to develop properly and may protect your baby against neurative defects. This is very vital in fighting your first trimester, that you can eat foods that so that's why we're highlighting the foods that have high sources, that have high that are high in choline. We look at eggs, beef, chicken, fish, potatoes, Irish, sweet potatoes, kidney beans. These are things that are very readily available. So I'm not going to be telling us things that are not readily available. These are things that you can lay your hands on. So eggs are very important. They are high in choline. So you can incorporate eggs in your diet as much as possible. And remember, I know during pregnancy, we tend to also be weight conscious. We don't want it to be over. We don't want it to be under. We want it to be adequate. You are expected to gain about 10 to 11.5 kg over the course of your pregnancy. 10. So sometimes, because I see a lot of us, once you just come for antenatal class and you climb on the weighing scale, you start quarreling with the weighing scale. It was this the last time, now it's this. Your weight will certainly increase. But what you eat also contributes to how much weight you're going to gain. We're also looking at you gaining adequate weight, because too much weight is not good and too little is not still good. So that is why we're highlighting some very important foods that you can incorporate into the diet that will give you and the baby what you need and what the baby needs. And sometimes I try to tell some of us that sometimes our babies tend to be selfish, because no matter what it is you have, they are certainly going to take what they need first. So they will leave you to sort out yourself by yourself. So sometimes you tend to feel weak, you tend to feel very tired, because you've just gotten little and the baby have taken whatever it is that the baby needs, leaving you with whatever little that you have in your system. So that's why you should get the adequate amount, so that once the baby takes, you can still have enough to function. And we look at calcium. We supplement calcium too in pregnancy. Some of us, we give you calcium on every antenatal class to take daily. It is very important. Why? Because some of us don't get enough from our diet. Why do we need to take calcium in pregnancy? Because your baby needs calcium to build strong bones and teeth, and to develop a healthy heart, nerves, and muscles. So getting enough calcium also reduces your risk of hypertension and preeclampsia. We might not get into how it does all the things because of time constraints, but just keep in mind that calcium is very important. So the food sources where you can get calcium is milk and dairy products like yogurt. Some of us, if you can go with parfaits are good, because they add a lot of nuts into it too. Some parfait, you see there are strawberries in it. And then you can go with yogurt, which is also good, which you can take in between meals too. Then very important, we're looking at iron. Iron helps the body to make extra blood, like hemoglobin, for you and your baby during pregnancy. Iron also helps to move oxygen from your lungs to the rest of your body and to your baby. So getting enough iron can prevent a condition of too few red blood cells, which can make you feel tired. That's a condition we call iron deficiency anemia, which is very risky for you and your baby in pregnancy if you develop it. So this can be prevented when you eat foods that are high in iron. Those foods are meat, seafood, And when we talk about seafood, there are certain seafood. There are ones that contain low mercury. There are certain fishes that you shouldn't go for. For fishes like salmon, they are very good. Salmon is good. So if you can get those kind of fishes, they are still good. And in our areas, we still have things like sardine, even though that the cholesterol level is a little bit on the high side, but it is still good. It has low mercury. So there, spinach is there. Then and snacks to help you. Then looking at food because the body works to get absorb certain foods. There are nutrients that help the body to absorb. So vitamin C helps the body to absorb iron. So you also need to eat foods that are high in vitamin C. Those foods are like tomatoes, and potatoes, strawberries. They are readily as possible. Inculcate these things into your diet. Uh, Then we'll look at omega-3, the food sources that increase, there's this we call DHA. It has been shown to prevent preterm labor and delivery. And also it helps also to in the development of the child's brain. Some of us getting smart children will want to get very, very smart children. Also, the diet plays a very important role. So we can also incorporate foods that are high in omega-3 in our diet. And we'll look at vitamin B12, meat, fish, we've already talked about that. Eggs, they are very rich, they can give you that. And this vitamin B12 supports brain and nervous system development. And also the body needs to absorb, needs this vitamin B12 to avoid absorb folate and choline in the body. So from your diet. Now, this other, we've also looked at folate. That's folate is the nutrient part of it, but the synthetic part of it is folic acid, which you know we also supplement folic acid in pregnancy. So folic acid is necessary because it helps in nervous system development too, and also preventing neural defects in your baby, especially in the first trimester. So it is also good that you get foods that are high in folate. Then I want us to look at some myths about diets in pregnancy because some of us it's because of the things that we hear that makes us to avoid eating certain foods. Now, myth one, you should be eating for two. Literally that is true. You should be eating for two, but we're not looking at instead of looking at eating for two in quantity, you should look at eating for two in quality. Like the double of the nutrients of the essential nutrients you're supposed to get for your body is what you should be looking at in the food, not the quantity of the food. Because sometimes when you see the say she's pregnant, it's okay now, let her just eat. She's pregnant. And you just be in your tummy, and sometimes it makes you very uncomfortable after eating because of the large volume of food you have just ingested. So please, admit that when you should be eating quantity of food, but look at the quality of the food made. Myth two, eating change the color of the baby, or it will affect the color of the baby. Of your baby comes from the genes. We call it a phenotype. So it's a product. So what you eat does not change the skin color or does not affect the skin color of your baby. Now, myth three, some foods can cause a miscarriage. That's also a myth. necessarily there are no food that directly causes miscarriage. It just depends on there are other things that are surrounding it that can make you have a miscarriage, not the food you eat. Now, eating herbs and tonics will make the baby more intelligent. Eating herbs and in Africa we might not rule out some things, but eating herbs and tonics does not help the baby. Does not help the baby's brain to develop more. We also mentioned some vital elements that can help the baby's brain to develop more, which can be inculcated in your diet, not necessarily herbs and tonics. And herbs and tonics sometimes can be, you need to be very careful if you have to use them in pregnancy. If you have, please avoid them. But if you cannot do with them, you need to be very careful. And let your doctor or let your gynae know whatever it is that you're taking at any point in time, whether it is recommended by somebody. Please discuss the things that you take with your doctor. It is very important. Now, full cream milk is more nutritious. We can't really say that full cream milk is more nutritious, but some people, because of preferences, they prefer it. But it tends to have more saturated fats. So than the other one, it might be sweeter for you, but it has more saturated fat. So there are also some special dietary considerations that we have to look at when you're pregnant. Um, like some people in the first trimester, they tend to have morning sickness where they vomit a lot or they're always nauseous. So they vomit a lot. There are certain ways there are certain things you can eat that can help with this particular thing, or that can just help. We're not saying that it is going to make it completely go away, because it is because of the changes in your hormones. It may not go away, but it will help you to cope better with it. You can eat crackers, cereal before getting out of bed. Some of us eat very early before we sleep, and then when you're waking up, you're already waking up you're waking up very hungry. The stomach has released a lot of acid. It can, anything you eat afterwards, maybe after getting up, you might just throw up. So you can try to take cereals or crackers while you are still in bed. So breakfast in bed is important, and your husband can help you. Eat small frequent meals throughout the day. Instead of eating large volumes of food, you can go for small frequent meals. Small frequent meals, like you can always take snacks in between. You can snack. Snacking is key. Then avoid fatty, fried, spicy, and spicy foods. There are things you liked normally, and then because of the pregnancy itself, the cravings and everything, some might not, the things you used to like, you might not like them anymore, but you should try and avoid foods that are very fatty or foods that are fried already, because they can trigger vomiting. They can still make you more nauseous. So, and also it's very good for you to actually know what your body tolerates and what it doesn't. Sometimes you can perceive some things and it will make you more nauseous, it will make you to start nauseating you. So you can avoid those things. In cases where you can avoid them, also you can try to use things that can help you suppress the vomiting. Because the more you vomit, the more tired you become, and then the more energy you lose, and it can make you just out, it can just make you feel out of it most of the days. It's still normal feeling in pregnancy. So but we're trying to see ways that we can help, that things that can help you to cope better with it. Then you'll tend to be more constipated in pregnancy. That is also because of hormonal changes. The effect of the hormones on your bowels will also make you more constipated. So you can eat more fresh fruits and vegetables. We've already encouraged that you should eat more of fresh fruits and vegetables. Fresh fruits and vegetables. And remember, whenever you're taking fruits or vegetables to limit the rate of infection, please and please wash your fruits and vegetables very well. If it is impossible, if it is very possible, some of us are used to allowing the market women to cut vegetables for us because it makes it easier for you to just cook. But please wash your vegetables before you cut them because this will reduce the risk at which you get infections. So wash your fruits, but eat more fresh fruits and vegetables. This will help you increase your bowel movement. Please drink like 6 to 8 glasses of water a day. As much as you need it, the baby still needs it too. So please drink more water. Um, drink 6 to 8 glasses of water per day to help with the constipation. And taking foods that are very rich in fiber will also help, like foods that are rich in fiber, like garden egg, cucumber. You can take those, and it will really help with the constipation. Then certain foods for you to avoid during pregnancy. Please avoid high mercury fish. When we talk about high mercury fish, we're looking at saltfish, marlin, shark, and mackerel. Please avoid these fishes. You can go more for low mercury fish like salmon, sardines. These are low mercury fishes. Mercury has a very, very adverse effect on the baby. So please avoid high mercury fish. These raw fish and shellfish can be contaminated. Raw fish and shellfish can be have adverse effects on the body. Somebody might necessarily say, no, nobody eats raw fish now. Nobody will eat raw fish now. But there are certain foods that you need to make, and then you use raw fishes and shellfish for them. So you have to be careful with these things. And you should avoid eating raw uncooked meat. They may contain very harmful bacteria. Meat should be cooked all the way through. So if you're going to take suya, you're going to take anything, please let the meat be cooked properly. So we advise that you make your food certain times, most times when you're pregnant, make your food so that you can be sure of how it is being prepared. Then fruits and vegetables may be contaminated, like I said before. So please wash all fruits and vegetables with plenty of clean water. Wash them very well with plenty of clean water. And when we're eating vegetables sometimes, because of the mode of preparations, some of the vitamins that are contained in these fruits and vegetables, they are very fragile. So once you overcook them, they lose, the nutrients goes away. So you're virtually getting close to nothing. So like vegetables, some vegetables, you can steam them a little and just eat them so that they can still retain their nutrients. Don't consume unpasteurized milk, cheese, or fruits. They can increase your risk of bacterial infections. Please, when we're talking about unpasteurized milk, some people make homemade yogurt, homemade homemade ice creams, because all those things sometimes homemade mayonnaise, they use unpasteurized milk for them. Please, if you're going to, please don't, as much as possible, and you take very little if it's really necessary for you to. Then avoid all alcohol. Drinking alcohol can increase the risk of miscarriage, stillbirth, and what we call fetal alcohol syndrome. They are very harmful to your baby and to you. So please avoid alcohol while you're pregnant. Limit caffeine intake. Some of us are already addicted to coffee, so you feel like you cannot do without it, but you have to limit your caffeine intake while you're pregnant, because high caffeine intake during pregnancy may limit baby's growth, and it can also cause the baby to have low birth weight. Raw sprouts may be contaminated with, so you have to cook them very well before you use them. So eating processed food during pregnancy can increase your risk of excess weight gain. You know, we're already weight conscious, so, and gestational diabetes. So please, when you're pregnant, avoid all these processed foods like Indomie, and if you must eat Indomie, spag, macaroni, all these things, like you have to eat all these processed foods, highly processed foods. Please, you need to add a lot of vegetables to them. Add a lot of vegetables, because some of them, the fibers in the food have already been processed out, they've been removed. So the body finds it very, very difficult to digest this food, and then there are little or no nutrients that are in them already. So if you have to eat them, you have to fortify them well. You can eat them with eggs, eat them with fishes, eat them with vegetables. That will make it more balanced, and then the body will be able to digest them. Then that brings us to the end of diet in pregnancy. And we're moving over to pregnancy and exercise, which will be the last of our topic today. During pregnancy, why do you need to exercise during pregnancy? Like I said earlier, pregnancy is not a disease, so you don't necessarily have to start feeling uncomfortable with yourself, or you just start carrying yourself as if you're not sick, you're just pregnant. So doing exercise can help increase the heart rate steadily and improving circulation of the body. Exercise can also reduce the risk of obesity and then its related complications like gestational diabetes and hypertension. And exercise prevents constipation, varicose vein, back pain, pregnancy complications. It can help you feel really good with yourself. It helps to keep the body flexible and strong. There are softening of ligaments, which can cause a lot of body pains and body aches in pregnancy. So you need a little amount of exercise for you to be for your body to be flexible and strong. Supporting and controlling, it also helps to control weight gain. You need adequate weight gain. Exercise is also recommended. Exercise and diet, and you're good to go. Preparing the muscles for labor and birth. Certain exercises also helps to prepare the muscles, prepare the body, prepare the pelvis for labor and birth. And also exercise can prevent what we call DVT, which is a very, very high risk complication in pregnancy. Improving sleep and emotional health. After exercising, you feel good, you sleep better. It has this way of rejuvenating you. So you need exercise even while you're pregnancy and when you're pregnant. Please, there are people that should, if you must exercise, there are certain conditions that if you must exercise, you have to discuss it with your gynae, and then you have to also limit. But there are also conditions where you have to avoid exercise entirely. Sometimes when you're pregnant and you already have an underlying heart and lung diseases, please be careful with exercise. When you have preeclampsia, that's hypertension in pregnancy, we call it preeclampsia. It can have a high risk. It's very risky for you and your baby too, so you need to be careful. Cervical problems. There are people that have cervical incompetence. They have different kinds of cervical problems. So any amount of exercise can be risky for you and the baby. And some people have persistent vaginal bleeding during their second and third trimester. Please limit exercise. If possible, avoid it. Speak to your doctor. Placental problems. And then preterm labor, please avoid exercises. Premature rupture of membrane. When the membrane, that's the bag of water that is holding the baby, when it's already broken or when it's ruptured, you might as well limit the amount of exercise you get, because it can cause things that we call cord presentations or cord prolapse. The cord can just come out, which can be detrimental to the health of the baby. And then when you have severe anemia, that's the red blood cells that is circulating in your body is low. Which also makes you very tired and weak most of the time. You have to be careful with exercise, and if possible, you have to avoid exercise. Then there are suitable exercises which you can do in pregnancy, which are not very harmful in pregnancy. You can do things we call brisk walking, swimming, indoor stationary cycling, prenatal yoga, low impact aerobics under the guidance of a certified aerobics instructor. Special exercises can help you to prepare for. There are also special exercises that help you to prepare for labor and delivery, which is squatting and pelvic tilt. You can also get how you can do these exercises in This video is recorded and you can get this exercises and how you can do them, and you can also look some of them up in on YouTube just to get these exercises. They are very, very important. So you can look them up and then you can do the ones that are very suitable for you. And you will feel really good after these exercises. So please do the one that you can as much as your schedule can permit and as much as your body can take. But it has to be limited to little exercises. So many outdoors exercises that involves you jumping up and down is not advisable. And even if you're good to do things like yoga exercises, please avoid lying on your back for a very long time, because we also look at postures in pregnancy. Please, if you have any questions, please ask your questions. And then you can also drop some of your questions on the chat box and we'll attend to them. Thank you for joining us in this class. Thank you for joining us.